Bone fractures overview. A bone fracture is a medical definition for a broken bone. Fractures are usually caused by traumas like falls, car accidents, or sports injuries. But some medical conditions and repetitive forces like running can increase the risk for experiencing certain types of fractures. If you break a bone, you might need a surgery to repair it. Some people only need a splint, cast, brace, or sling for their bone to heal. How long it takes to recover fully depends on which of your bones are fractured, where the fracture is, and what caused it. What are the different types of bone fractures? There are many different types of fractures. Your provider will diagnose a specific fracture type depending on a few criteria, including its 1 is pattern. A fracture pattern is a medical term for the shape of a break or what it looks like. Second is the cause. Some fractures are classified by how they happen. Third is the body part. Where in your body you broke a bone. The types of fractures are as follows: the oblique fractures, transverse fractures, green stick fractures, comminuted fractures, spiral fractures, and stress fractures. A bone fracture may occur as a result of a fall, a direct blow, to the bone twisting injuries, wear and tear, and high energy traumas such as sports injuries or motor vehicular accidents. The fracture may significantly limit your lifestyle and activities of daily living. The first types of fracture is transverse fractures. The transverse fracture ran horizontally, perpendicular to your bone, opposite the direction of your bone. You might see them referred to as a complete fractures. This means the line of the break goes all the way through the bone. Transverse fracture usually affect long bones in your body. Some of the most common include the femur, the tibia, the fibula, the humerus, the radius, and ulna, and clavicle. The transverse fractures are almost always caused by traumas like falls or car accidents. You might need surgery to repair your bone. Some people only need a splint or cast for your bone to heal. The second types of fracture is an oblique fractures. They happen when one of your bone is broken at an angle. You might see oblique fractures referred to as complete fractures. This means the line of the break goes all the way through your bone. Oblique fractures usually affect also long bones in your body. Some of the most common include femur, tibia, fibula, humerus, radius, and ulna, and clavicle. The third is the spiral fracture. They happen when one of your bones is broken with a twisting motion. They create a fracture line that wraps around your bone and looks like a corkscrew. You might see spiral fractures referred to as complete fractures. This means the line of the break goes all the way through your bone. The spiral fractures usually affect long bones in your body. Some of the most common include the femur, tibia, fibula, talus, humerus, radius and ulna, phalanges, and metacarpals. The spiral fractures happen when a fracture winds around the length of your bone, like a spiral staircase. They can be caused by falls, accidents, and sports injuries when your bones are twisted with great force, like getting cracked in a football. The next types of fracture is a comminuted fracture. The term comminuted fracture refers to a bone that is broken in at least two places. These fractures can affect any large or long bone in your body. Some of the most common include the femur, tibia, fibula, humerus, radius and ulna, clavicle, skull. Comminuted fracture are almost always caused by serious traumas like car accidents or falls from a high place. They are very serious in large bones, and you will often need surgery to repair your bones. Sometimes, comminuted fractures happen to smaller bones and can heal without surgery. How long it takes to recover depends on which of your bones are fractured and what caused the breaks. Most people need up to a year to recover from a comminuted fracture if it involves one of the long or larger bones in your body, especially if it requires surgery. The next type of fracture is an open or compound fracture. A compound fracture is a break or crack in your bone that is visible through your skin. Generally, bones breaks a result of force and or trauma like a car crash. Fractures can also be caused by less traumatic but repeated forces. What makes a fracture compound or open is when the broken bone pierces your skin. If you happen to fall from a ladder and land on your arm, breaking it, you'll know it's a compound fracture if you can see the bone. Simple or closed fractures don't break through your skin. Compound fractures are extremely painful. It's also frightening to see your bone exposed. The last types of fracture is a stress fracture. A stress fracture are usually overuse injuries. They happen when physical activity puts too much pressure on a bone and it doesn't have enough time to recover. Stress fracture starts as bone bruises that eventually become small cracks in your bone surface. The common causes include playing a sport and a repetitive motion you do for your job. The healthcare providers sometimes call stress fracture overuse injuries or wear and tear because repetitive using the same part of your body usually causes them. You might also see stress fractures called hairline fractures, a name that refers to a hairline crack that forms in your bone. The stress fractures usually affect weight-bearing bones in your lower body. These are the bones that supports the weight of your body when you're standing or moving. You're most likely to experience a stress fracture in your lower leg, your tibia and fibula, the foot, especially your metatarsals that connects your ankle and heel to your toes, heel or calcaneus, lower back, hips, hand, and wrist. The signs and symptoms of bone fracture. First is pain or severe pain, swelling and tenderness, bruising or discoloration of the affected area, numbness, tingling sensation, instability, bone deformity, and inability to move a part of your body like you usually can, or inability to bear weight.